the first technology on the Optimus Max that I want to talk to you today about is the Forma. And this is a great place to set up the principles that hold true for radio frequency. So just understand, if I'm talking about radio frequency, this principle holds true, but I'm only going to deliver it once, and that's kind of the physiology of how this stuff works. So as we age, some things happen to our skin. We get degradation of collagen, solar elastosis, thinning of the dermis. All of those things happen as we age. So our job as medical providers, one of them, is to correct those signs of aging. That's what we're in the middle of talking about. One way that we can do that is through heat. This is how InMode has changed the aesthetics game. This is how all of these devices that hold the bipolar radio frequency work. I don't know any other place that you're going to get this picture, so take pictures of all my slides if you want them, because I don't know where else you'll get them besides my platform. So this is how this works. Radio frequency is a current. It's an electrical current. It's got a positive pole, negative pole, and the electrical current is going from positive, negative, positive, negative, positive, negative. And that current is creating jostling, an ion collision in the molecules of the skin. That's kinetic energy. If you remember anything about physics, kinetic energy is then transformed to thermal energy. It's let off as heat. That heat causes all the reaction that ultimately changes the tissue in the way that we want it to. So the heat causes a controlled damage to the tissue, which creates an inflammatory response, a positive one, and that triggers wound healing. That wound healing results in new collagen formation and old repairing of old collagen. So heat, fibroblasts, fixes and lays down new collagen. That's how all of this works. The Forma is what we are specifically talking about right now. It has a positive and a negative pole, and this is going back and forth to create that reaction in the skin that we want to improve texture, fine lines, tighten skin. And this, friends, is on a short list. The Forma, specifically, write this one down, is on a short list of things that have very, very minimal to no downtime. At worst, you're a little puffy and red, but my team calls it perfectly plump. It's actually a great treatment to do the day before a red carpet event. So if you want like a red carpet facial or red carpet ready, add Forma to whatever you're doing, because it plumps you up. That little plumping effect will help with fine lines and wrinkles. Gives you little rosy cheeks. It's actually, so I would call it no downtime, and that's the short list. There's very few things, and your world I know is just like mine. You come into my office, I'm stabbing you, I'm plucking you, I'm poking you, I'm lasing you, cutting you, right? You're getting something. This is on a short list of things that don't hurt and have no downtime. That's a short list for all of us. So it's important to point that out. And then all of these devices that have the radio frequency, so we're talking a lot about radio frequency, all of these have this principle, and this is single-handedly what brought me to InMode, because in my fellowship training, I got to have my hands on everything. I was fortunate to get my hands on everything. If you name it, I've used it. And I landed here because of this principle, because what I found in 2010 and 2008 was the devices that we had were great for the time, but they were inconsistent. So I'm not here to bash anybody. I'm just here to tell you about my experience and help you with some business principles. So I'm not bashing anybody. But I won't name specific names, but globally, 2010, laser-assisted lipo was really, really big. Some of us may still be using it. That was like first gen. It was good, but the idea was the same. Try to create heat, controlled damage that your body repaired, ultimately tightened the skin, right? That was the thesis behind laser lipo. The problem was temperature control was challenging. I didn't even know what my temperatures were, right? I didn't adequately heat up the entirety of the soft tissue envelope because I was like wielding a lightsaber under somebody's skin, so it was very tracked. It wasn't this confluent, nice heat. And so that led to inconsistency of results. Then comes InMode in 2016, and they have, in all of their bipolar radio frequency, a couple of things. The first thing that they have that's way different is thermistors. Think of it as a thermometer. It's measuring, these devices are measuring the skin temperature 1,000 times a second. 1,000 times a second. And you, as the medical provider, based on your patient's exam and goals, set the endpoint temperatures that you're trying to achieve on these devices. And guess what happens when you get to the endpoint temperature? The energy to the handpiece shuts off. The machine automatically does that. So you set 42, 43, 40, whatever, based on your patient's exam and goals. You set that endpoint temperature, And the machine is measuring 1,000 times per second, and then when you hit your endpoint, shuts off, keeping you safe, keeping your patient safe. But what that does is it allows me to get to my endpoint temperature. We know at around 36 or 38 degrees Celsius, the fibroblasts are flipped on like a light switch to do what they do best.